What are the differences between NP, nurse practitioner, and PA, physician assistant or physician associate education? That's what we're talking about today. I'm linking this video up here. This is the original video I did comparing the two. However, I want to revisit this issue. I want to make this maybe into a multi-part series. Today, we're talking about the differences in education as a whole and kind of what I see in practice. So for full disclosure, I'm a nurse practitioner, now a CRNA student. I am not a PA, but I have quite a few friends who are PAs, and I've done some research into the different aspects of PA education versus NP education. And I want to talk to you about those today because I think it's vitally important. My name is David Warren, and if you're new to this channel, consider subscribing. My content is all about being a CRNA student and being a nurse practitioner. Today, we're taking a dive into the nurse practitioner / PA route. We are delving a little bit away from the CRNA content today. So NP and PA education, I've got some notes written down, so I'm going to intermittently be looking down so I don't miss anything. I want to start with the nurse practitioner profession because that is what I am, or that is the profession that I am associated with, and I think something very easy for me to talk about. So I want to start with that, and I kind of want to break this down by section. So we have to start with what is a nurse practitioner, and I think that's a really good question. What is a nurse practitioner? So a nurse practitioner is someone who is a nurse that has a minimum of a bachelor's degree. However, we will talk about some different routes to entry, but historically, minimum of a bachelor's degree who has been educated at the master's or doctoral level in a population focus. That population focus can be something like family medicine, an FNP, family nurse practitioner, a pediatric nurse practitioner in primary care, a pediatric nurse practitioner in acute care, an adult primary care nurse practitioner, an adult acute care nurse practitioner. Actually, now they're adult geriatric primary care nurse practitioner, and adult geriatric acute care nurse practitioner. Women's health nurse practitioner, psychiatric nurse practitioner. You see all of these different confounding variables that play into this. There are so many different population foci that you can go into as a nurse practitioner, and that is one main point that I want to hit on here is you have to choose a population focus to be a nurse practitioner. If you want to be a family nurse practitioner, you are educated in family medicine, internal medicine across the lifespan, so from birth until death. And that is by far the most popular route for nurse practitioners to take, to be a family nurse practitioner. With that provides lateral mobility, meaning you can work in family medicine, you can work in pediatrics, you can work in an outpatient specialty clinic, you can work in urgent care, you can work in dermatology. There are a wide array of areas that you can work in depending on what your population focus is. And so whenever you are applying to NP school, you're obviously looking at that, like what population focus do I want to go into? And we're going to contrast that with a PA route here in just a moment. But on the NP side, you have to pick a population focus or a specialty. And within that specialty, you are going to take some core courses. You're going to take like advanced pharmacology, advanced pathophysiology, advanced physical assessment, and then some like nursing research classes, biostatistics, etc. And then you're going to go into your clinical courses. So the core courses of being that flavor of a nurse practitioner. So you're going to take courses in family medicine, courses in internal medicine, courses in pediatrics. If you're doing FNP, if you're doing like adult acute care, you're going to take like complex management of acute and critically ill patients. So I am a family nurse practitioner and an adult gero acute care nurse practitioner. So I've done both of those, and I can kind of speak to what those classes were like. Again, you're taking courses that are kind of wide and broad with those pharmacology, physiology, assessment courses, and then you're getting more narrow as you go further into the program with courses that are geared towards whatever your specialty is. If you are in a psychiatric program, you're going to take courses geared towards being a psychiatric nurse practitioner. Obviously, you're not going to take courses geared towards being an ICU nurse practitioner or adult acute care. It just doesn't make sense. And so that's one of the big differences so far is in NP school, you're going to be taking courses geared towards your specialty, not broad as a whole. You take some broad courses, like we said, pharmacology, pathophysiology, and advanced assessment. That's kind of across the lifespan. But then once you get further into the program, you're delving into the specifics of whatever specialty you have chosen. As far as the degree, most programs are still master's level or entry by master's program degree certificates. And so whenever you apply to these programs, you're going to end up with either a master's degree or a doctoral degree. For a while, it was strictly master's degree. Now there is a transition going towards a doctoral degree. So a DNP, Doctor of Nursing Practice. There are a lot of entry doctorate programs now. And really the main difference is in a DNP course, you're taking more courses related to like nursing theory. Sorry, there's like an ambulance going off in the background. Hopefully it's not transmitting through. Back to the topic here. You're taking courses in like nursing theory, nursing process, more like nursing related courses, and not necessarily anything that's going to bring up your clinical skills in any way that would be different than being in a master's program. And so I initially started out in my NP program in a master's level program, switched to a doctoral program, and then ended up switching back to a master's program because I looked at the curriculum and I was like, this is just not going to be helpful to me right now. Like there are courses like translating evidence into practice, population health, biostatistics, things that like would be good if you want to teach at the academic level. And that's fine. If that's what you want to do, you want to teach, go for it. Go get your PhD or your DNP. If you want to translate evidence into practice, DNP is better for that. If you want to do original research, PhD is better for that. However, just know to be a good, effective clinician, you don't need a DNP degree right now. Now, at some point, that may be required in the profession that you have a DNP degree, entry into practice. But as of now, the recording of this video is March 22nd, 2023. As of today, you don't have to have a DNP to be a nurse practitioner. Could change, so stay tuned for that. But there are a lot of master's degree entry programs, meaning it's 2 years long. Some maybe 3 years, depending on if you go part-time or full-time. But if you're going like I did, part-time, year-round, so summer, fall, spring, all at once, or I guess it would be spring, summer, fall for like a year at a time, 2 years, then you're done. And so that's what I did. I didn't have any breaks, but that, and it depends on your program. So some programs, maybe 2 years full-time, you may have summers off, it may be 3 years. It really depends on how and what program you go to. Now, another thing is the way the program is offered, I guess is the best way to put this, whether it's online or in person. The vast, vast majority of NP programs are online. And I have a big opinion about online education and online NP programs. This is not the particular video for that. I'm here to just give you the information and say there are online programs to go to for nurse practitioner. There are in-person programs to go to for nurse practitioner school as well. And this opens up a whole can of worms because there are those programs out there, I'm not going to name programs, but there are like proprietary NP programs that are just online. They're not affiliated with like a university. They're their own online university, and anybody can get in. Let's just be real honest about that. If you have a pulse and you have a nursing background, you have your RN license, you can get into NP school. And so that's one of the big things that I want to highlight in this part of the video is what we call barriers to entry. And the barriers to entry to nurse practitioner school are extremely low. Like I said, you have to have a pulse, you have to have a nursing license, and that's really about it. There are some programs that make you have experience before you go into that particular program. However, there are programs that you don't have to have any experience as a nurse to go in. And so that's something important to highlight is you may not need any nursing experience at all to enter into some of these programs. Depends on where you're going. Again, I know, I've read the comments, I've seen there are programs that require experience. I'm not negating that. There are also many programs that don't require experience, and the barriers to entry is something that you have to consider. Everybody can go, anybody can go, as long as you apply, basically you can go. And so this is not the video to talk about all the odds and ends and the goods and bads of that, but I just want to lay that out for you, that the barriers to entry are low. As I said earlier, the didactic component of the program is mirroring whatever population focus you're in. So family nurse practitioner, you're doing family medicine, internal medicine, pediatrics, some women's health, etc. You're not doing critical care of the pediatric patient or of the adult patient in your FNP, family nurse practitioner program. So that's one difference that I want to highlight for you there. For the clinical portion of the program, you have to have a minimum of 500 clinical hours to sit for your national certification exam. Minimum 500 hours. And this is going to vary by program. Like my program required, I think 800 or 900 hours. I can't remember exactly. It's been so long ago. We had to do that many clinical hours to graduate from the program. And the board certification to test or to sit for the national certification exam, you had to have a minimum of 500. So obviously we were way over that, meeting that expectation without issue. It's going to depend on the program as to how many clinical hours you do. Your clinical hours are going to be in whatever population focus you're in. So again, going back to what we said earlier, like you're educated as a family nurse practitioner, you're going to do rotations in family medicine, in internal medicine, in pediatrics, in women's health, in some basic psychiatric care, not the like in-depth psychiatric care. But you will see patients in primary care that have depression, anxiety, things of that nature. So basic psychiatric needs that you can address as a primary care provider. That's what you would do. On the adult acute care side, you're going to be doing clinical rotations in the ICU, in acute care environments, and specialty clinics, things like that. Now, one difference to highlight here, and we'll get into the PA side of this later, is for the nurse practitioner clinical rotations, pretty much every school, you're going to have to set those rotations up yourself. You are going to be responsible for finding your own preceptor, securing that rotation, and making sure that everything's lined up to get your clinical hours in place. So the school usually gives you guidance on you have to have so many hours in this specialty, so many hours in this specialty, or whatever it is. And so for the nurse practitioner side, it's hours. You have to have 500 hours minimum in your population focus. And there's a really bad part to that is students are left to set the rotations up themselves. Now, I will say this, there are some schools that set rotations up for you. It is the vast minority of schools that do that. For instance, my school helped in setting up rotations. I could also set up my own rotations if I wanted to. This was 10 years ago almost. Now, in today's environment, you have to set those rotations up yourself. It's very hard to find rotations and to set that up yourself. And I really think that does a huge disservice to the nurse practitioner profession because it's left up to the student. Many times students are like begging for a rotation. I see them on Facebook groups all the time saying, please, like I need to finish my last clinical rotation. I need so many hours. Will anybody take me? And that's not conducive to learning. That's not conducive to learning because you're just taking whatever you can get. And it's not good. It's not good. I think schools need to be held responsible for setting up rotations for their students. It's unacceptable that students have to beg and plead and take any rotation they get, and it may not even be a good rotation, and that's the point I want to make to you, is the rotation may be crap. It may be horrible. You may not get anything out of it, yet you're checking a box saying, oh, I did my internal medicine rotation, when maybe you were just like taking vitals for the doctor or something. Like I've heard horror stories of that kind of stuff. It would make so much more sense if the school set up rotations for the student in good experience environments. And I think that's something that the NP profession could improve on, is setting up, making mandatory that schools set up their rotations so students aren't just taking whatever they can get. Now, not to say that some students don't set up and get good rotations. If you have good connections and you have preceptors lined up before you enter NP school, you have agreements in place for good rotations, yes, that works very well. However, I've seen far too many times people come in begging for rotations that they just can't get, and they take whatever's offered to them, and that's not good at all. Now, after you finish your NP program, you're going to test and you're going to take your national certification exam, and the national certifying body is going to depend on what population focus you have. So for the family nurse practitioner route, you're going to take the AANP or the ANCC national certification exams. There are two exams. You take one or the other. Once you take that exam, you are certified. You don't have to retest again, which is big. You don't have to retest again. Now, we're going to talk about the PA route here in just a bit. It's different. For the NP route, once you take your national certification exam, you pass, You don't have to test again unless you let that certification lapse. The certification is good for 5 years, and you have to do so many continuing education activities within that 5-year period to maintain your certification. You also have to have so many different practice hours, like I think it's like 1,000 practice hours within that 5-year period to renew your certification. And so that's how the certification process works. You don't have to retest. You don't have to take a national certification exam multiple times. You take it once, you pass, you're done. You just do continuing education every 5 years to keep your certification renewed along with your practice hours. So that's a little bit about the NP side. One more thing I wanted to hit on before we move on is the cost of education. And so the cost of education is going to vary drastically depending on what school you go to. Averaging $20,000 to $50,000 is average for a master's degree as a nurse practitioner. Again, you can find some programs that maybe you're paying $100,000 and they're going above and beyond to set up your rotations for you, to give you housing, etc. If you're doing these online programs, I would say $20,000 to $50,000, somewhere in that range is very typical. Again, you can find cheaper programs probably, you can find more expensive programs. When I was going through nurse practitioner school, I actually qualified for a federal grant because I'm from an underserved area and I wanted to practice in an underserved area when I graduated. And so that allowed me to get my schooling paid for. I don't even think they offer this anymore. But had I not done that, it would have cost me about $25,000 to get my family nurse practitioner degree. Now, when I went back for my acute care certification, I had to pay for that out of pocket. I got to skip some classes again because I had already taken the pharmacology, physiology, and physical assessment, so I got to skip some classes. I ended up paying about $15,000 for that master's degree, for that certification. But again, some of my other classes, core classes that I had taken before counted. So the cost of education is something that you really need to consider with that as well. Okay, now we're going to move on to the PA profession, the physician assistant or physician associate profession. And again, heads up, I'm not a PA. I've never been to PA school. I have friends who are PAs, have done some research on this topic. So if anything I say in here is wrong, or if you have other comments, comment below. Let me know if you're a PA or a PA student. You guys know more than I do about this. I'm trying to give you a general overview of the different similarities and differences. So for the PA, physician assistant or physician associate is a individual who is educated either at the master's or doctoral level in medicine, and they are able to practice medicine under the supervision of an attending physician. And that supervision is loosely defined. Now, sometimes the supervision means that your attending physician is right there on site with you and you're running cases past the attending. Say if you work in the ICU as a PA, you're going to be communicating with your attending more frequently than you would if you worked in like urgent care or family medicine, and maybe your attending's off site and they just co-sign your charts. So that level of supervision is very different depending on whatever area you work in. And the same goes for nurse practitioner. We didn't really hit on this on the nurse practitioner part. However, it's something to mention. There are some states that you can work in as a nurse practitioner and you can work as an independent provider, Alaska being one. When I traveled to Alaska doing locums assignments, I very oftentimes was the only provider there because they couldn't get anybody there. And so even if I had to have a supervising physician, there wouldn't be one available because there's nobody there. So there were some PAs that had worked there with me, and their supervising physician was like 4 hours away in another city, and they were able to communicate by phone. So that level of supervision is very different depending on what area you work in. So obviously, like we said, you're in the hospital, you're in the ICU, it's a team-based environment. Same with an NP. You're going to be talking to your attending pretty frequently, running cases past that as a team, rounding on your patients, etc. Now, if you're in like family medicine or internal medicine, it's going to be different. So just keep that in mind as well. So that's a little bit about what a PA is. PAs are educated very broad and very general, meaning that they take courses across the lifespan and in any different area. And that is one huge difference that I want to highlight in PA versus NP is PAs can work in a variety of settings. There is much more lateral mobility. As we mentioned earlier on the NP side, there's like family nurse practitioner, acute care, pediatric, women's health, geriatric. There's so many flavors. As a PA, there's one size fits all. You're educated across the lifespan and in many different areas. You are graduating PA school being a generalist, and that works well in your favor because you can go from the adult ICU to the pediatric ICU to dermatology to cardiology. Now, that all sounds good, and I know it's a little different when you're in a specialty for 7 years or 8 years. It's hard to switch. Like, it may be hard to go from adult ICU 10 plus years over to the NICU or over to a dermatology clinic. Like, sure, you can do it. The reality is you probably need some experience in that area before you make that switch. So, but law-wise and scope of practice-wise, you can make that lateral mobility. You can work under your supervising physician in whatever area that they work in. And that's a cool thing about being a PA, is there's so much lateral mobility. The application process is quite a bit different for a PA school as well. As we mentioned on the NP side, very easy to go to NP school. Anybody can go to NP school. A pulse and a nursing license, you're in for sure. The PA route is quite a bit different. It is challenging, and some would probably say it's more challenging to go to PA school than it even is to go to medical school, because this is not the video to compare, to bring, medical school into this. We're talking about PA school, but a lot of people want to go to PA school for a lot of different reasons. And UPAs or UPA students, comment below, let me know what your admissions process was like. But from what I've seen, you have to have obviously a bachelor's degree, a decent, good GPA. You need shadowing experience. So as some nurse practitioner programs require experience as a nurse to get in, some don't. Most all PA programs require some sort of healthcare experience. Whether you've worked as an MA or you've worked in a clinic doing something healthcare related, you have to have some of those shadowing hours and that experience to get into PA school. And it's usually around 1,000 hours is what they're recommending now, from what I can see. And I don't know that it always used to be that way. I think maybe before you could go to PA school with anything. Nowadays, 2023 and beyond, you need some kind of experience to go to PA school. You're also going to have to take those pre-med courses like biology, biochemistry, physics, chemistry, organic chemistry, statistics, calculus, all of those things that like a typical med student would have to take. You're going to have to take those as a PA student. So the barriers to entry are quite higher for the PA profession than it is for the NP profession. You also have to interview, apply, etc. All the things that go with that. Take the standardized exams, a GRE. The barriers to entry are certainly higher for PA than they are on the NP side. Now, there are two different degree options. There's the master's degree and the doctoral degree. This used to just be a master's degree for the PA profession, and a lot of entry to practice programs are still master's degree. So right at 2 years, some 3 years, depending on where you go. However, there are some with a completion doctorate or an entry to doctorate called the DMSC, the Doctor of Medical Science. And from what I've seen, not many programs offer that. But that is a completion terminal degree in the PA profession, and that is more science focused than it is like on the nursing side with the DNP. That's more nursing focused. The DMSC is more science focused and more applicable to obviously the PA profession and to the background of medicine. So those are the two entries. Sorry, my computer screen went black here. Turn it on so I give myself a little light. As far as how the programs are offered, the vast majority of programs are on campus and or hybrid. And prior to COVID, almost all, I would venture to say that all PA programs were on campus and face-to-face. Now, there are some online PA programs cropping up here. I think they've taken after the NP profession, which is really interesting because I feel like that's a detriment to the NP profession. And now the PAs are kind of doing the same thing. There's Yale University, which is an online PA program. If you're a PA or a PA student, comment below. Let me know what you think about the online programs and how that's affecting education. But that's the way those programs are offered. And you're educated in a variety of areas. And so depending on what program you go to as a nurse practitioner, again, you have to pick that population focus, and that's the only area that you are educated in. PA is quite a bit different, and I've actually got this pulled up on my computer screen back here. So you have to do mandatory rotations as a PA. You have to do emergency medicine, general surgery, women's health, primary care, pediatrics, behavioral medicine, and internal medicine. Sorry, I'm kind of looking behind this computer screen so I get them all. And then you have elective rotations, and that's going to be like cardiology, cardiothoracic surgery, plastic surgery, pediatric emergency medicine, infectious disease, dermatology, hem-onc, all of those like elective rotations. However, there are mandatory rotations, and from what I've seen, there are not a certain number of hours that you have to hit to sit for your board exam. Like we said earlier, for an NP, you have to have those 500 clinical hours. As a PA, you have to hit these mandatory rotations, and that's actually much like CRNA school. So This is not the video for that, but in anesthesia school, we don't go by hours. We go by number of cases that you've done. You have to hit a certain number of cases. And sure, the hours like equal out to several thousand, but overall, it's based on the number of cases that you do, not the number of hours that you do. And it's much the same in the PA profession as well. So that's how the education looks. The clinicals, roughly 1,600 to 2,600 hours. That's a wide range, I know, but from what I've seen, that's the number of hours physically that you're doing in PA school and clinical rotations. But again, it's based on the rotations that you do, not the number of hours that you are doing them. And a big difference between NPs and PAs is in PA school, your rotations are set up for you. Like you are going to your rotation that's preset by your school. And so those are good rotations because the school is like having these agreements in place already before you ever get there, and you're told where to go, how to get there, and what rotations that you're doing. And it's much the same in CRNA school. You're told where to go, etc. Versus NP school where you're setting these up yourself. And I think we've already hit on that a few minutes ago in the NP side about how it's detrimental that a student is responsible for setting those up for himself or herself. So good thing in PA school, you've got rotations set up for you. I'm sure there are some where you may have to set the rotations up yourself if you're doing these electives, but the vast majority of rotations are set up for you in PA school. Okay, now that's the difference between, the superficial difference between PAs and NPs. This video is really meant to just highlight those differences. I want to do future videos about the practice differences between NPs and PAs. I've worked alongside PAs. Some of my best friends are PAs. I have a lot to say about that. This video is already long as it is. I'm not going to bore you with more content. I'm going to create a new video about that as well. So with that said, comment below, let me know what you think. What are the differences between PAs and NPs that I missed, that maybe I didn't hit on in this video, that you would like to see? Also, comment below and let me know what other videos related to this topic you would like to see. Like I said, I'm planning to do a video on like the practice environment, how they differ, things like that. One other thing that I need to hit on right before we leave that I totally forgot about is the certification process for PAs. I totally left that out, but let's hit on that for just a second. So once you graduate PA school, you are going to sit for the PANCE, P-A-N-C-E, and I think that's the Physician Assistant National Certification Exam, much like the National Certification Exam for NPs. You'll take that exam. Once you're certified, you do have to recertify, and I think it's every 10 years now. It used to be every 6 years, I believe, but from what I've seen, it's changed to 10 years now, I believe. Correct me below if I'm wrong on that. But you do have to recertify, meaning you have to retake that certification exam every X number of years to keep your certification up, along with doing continuing education and getting your practice hours in. So that's a little bit about the certification process. Now, I think we're done. Comment below, let me know what I missed. Thank you for watching, and I'll see you in the next video.